Bueno, pues empezamos, señoras y señores, ¿qué tal?
Okay, so let's start, ladies and gentlemen. Welcome to the second section after the coffee break. Our next break will be the lunch break, and now we're going to start a roundtable about suicide prevention.
I remember a very specific day. It was 2022, and I was in Madrid, in my flat, in the living room. I was studying. It was late in the evening. I was about to go to dinner. I was closing some law books I was studying at that moment. And suddenly I looked through the window and I saw my neighbor. I saw my neighbor falling down. And I heard a terrible noise, a very loud one. And I asked myself again and again, could we have done anything else that we do? Esta experiencia sin duda fue una experiencia que me marcó.
This experience was quite shocking for me. It left me traumatized for days, and it led me to ask myself, to wonder if us, who had listened to a lot of arguments in the upper floor, if we could have done more to prevent that death. And it led me to question myself something about someone that I met every day on the elevator, but I had never actually stopped to talk to. What must have been their terrible situation? Someone who lived just a few meters away from me, from us, to decide that they would rather take their life instead of continuing to live with the suffering that they must have been experiencing. I had a friend, Sergio Tubillo. He's the person supporting the unit of firefighters in Madrid towards suicide prevention. And what he says is that sometimes people who are about to commit suicide, the only thing they need is for someone to listen to them. The most persuasive technique, and what has helped me to stop a multitude of suicides, is to stop and listen. And that says a lot about the society in which we live in. All this is, of course, a lot more complex than what I could say here in just a couple of minutes, and you'll see that over the next few minutes in the roundtable. But after doing work on suicide for some time, there are things that have been clear, and we have to avoid suicide. We have to try to be reductionist, to stop giving labels to people, to stop having prejudices towards people. I think it's basic things that we have to start tackling. And of course, we have to tackle this topic towards empathy. And when we talk about suicide prevention, someone else that I talk to a lot, quite often, he started being a source, but now he's a friend. He's a clinical psychologist from Malaga, Miguel Guerrero. I remember a very specific anecdote. Probably many of you that work in mental health already know it, and it's the experiment of hope. It's the experiment of a rat. If you'll give me just one more minute, I'll tell you about it, and then we'll move on to the table. In 1920, a scientist put a rat in a bucket with water and with clean surfaces, and they put them there to see how long they lasted. About 15 minutes later, the animal died because of stress, because of a heart attack, because of the stress it caused it to be there without being able to get out. Next day, he repeated the experiment. But when the animal was about to die, he gave a cork so the animal could climb into it, and they saw that there was an animal. He repeated that sometimes, and he put the rat in that bucket again. Remember, the rat that at first lasted for 15 minutes swimming, now the rat lasted for 60 hours. 15 minutes versus 60 hours, because the animal knew that at any point there could be a cork, any kind of salvation device, any kind of floating device that could save them, that could save it. So that's what's going to be the topic of Dolores Lopez and her presentation. She's a survivor, she's a professor, and she's a specialist counselor on suicide prevention. Dolores Lopez, welcome and thank you. You have the floor.
A ver. ¿Ahora? Sí. Gracias y buenos días.
Thank you. Good morning. It is really important to talk about what concerns us and what is concerning to us. So it's important to work on this framework that gives hope, to give a feeling that a cork might appear at any given time. Suicide is a scream for desperation from someone that cannot take any longer the suffering that they're living in. This summit places in the European public agenda suicide and mental health. Creating a common framework to tackle this is a goal that means a great advancement in prevention. Suicide prevention is a priority for public health for the World Health Organization. We know, as the topic was very well introduced by my colleague, that it's a multi-factor problem. We cannot reduce it to something that's simple. They committed suicide because of this or because this other reason. There are many factors, many reasons, and it's cross-sectional to all cultures, even though each culture has a specific meaning to it. Today, we're gathering to talk about suicide prevention in Europe because we believe that suicide can be prevented. The people who are here with me, Pilar, Alexander, Nell, they all work relentlessly with the focus on this problem to try to achieve that goal and also to try to reduce stigma. We're going to do a first intervention for each one of them. Pilar Aparicio will begin. She's a General Director of Public Health from the Spanish Ministry of Health. Then the following will be Alexander Grabenhofer. He's the head of the Department of Mental Health in the National Institute of Public Health of Austria. And the closing of this intervention will be done by Nel González. He is the dear president of the Mental Health Confederation, and it has been existing for 40 years already. After that, all of us will go back to our table situation and we'll give a feedback for questions, for a debate of this that concerns us about how to tackle suicide. So with no further ado, I'll give the floor to Pilar so that she can start with her presentation so that Alexander and Nel can continue after that. You have the floor. Thank you very much, Dolores. I just wanted to give a very quick vision on how from the national health system we wanted to tackle suicide. As I was saying before, in our strategy for mental health in line 3, strategy line 3, we talk about prevention, early detection, and attention to suicidal behavior. In this sense, the strategy creates these two big lines, early detection and prevention, and also improving the attention to that suicidal behavior. I was saying that that strategy has that action plan that specifies measures, and it also had 6 specific lines, in which line number 4 is prevention and early detection of and attention to the suicidal behavior. We have 8 action plans or specific actions. One of them that I'll be talking about that is in charge of the Ministry of Health or the government, which was the 4.1, which is the creation of a phone number in order to give a response in some way. As Pablo was saying, as his common friend was saying, Sergio, the fireman, was saying that importance on communication and having someone who can listen to you on the other side. On the other hand, 4.2 is the code of risk of suicide that what it intends to do is to make it faster to have a better social and healthcare services for all those that have some kind of risk of suicidal behavior. And point number 3 is to facilitate in some way the access and the circuits inside the healthcare system. Number 4 is to develop tools that are going to make it possible to have an identification and detection of early behaviors or conducts that are having thoughts related to suicide. We're especially talking and working about children and teenagers. It also has a specific point of training in early detection of suicide. For us, having a registry is very important. We question sometimes that we don't only want to have the data of the suicides that have happened in our country, because in Spain, what they do, who does this is the Spanish National Institute of Statistics. and also to give a service to those people who are affected and those who have had an attempt of suicide. And it's one of the topics that concerns us. When we talk about the importance of giving care to those people who have a higher level of vulnerability, in this case, the elderly or young people, in the cases of gender-based violence, sexual violence, or those people with any kind of disability, we thought it was also essential to tackle this topic in the media so that we can tackle it specifically. These are the projects that are co-funded in this action plan in the regional governments, training in prevention, code suicide, the early detection of suicidal behavior. You can't really see the chart there, but in somehow with the different colors, as I said before, in the initial assessment that we are doing on how the communities and regional governments have been developing plans and actions inside the mental health strategy with regards to suicidal behavior. You can see in green what has been done, in yellow what's being done right now, and in red what has not been done, and in gray what is have not answered. In relation to the code of the risk of suicide, what has been done is a color that's around orange, more or less. Progress is violet and not done in red, with different kinds of interventions. In this sense, 024 was just a possibility of giving an immediate answer to those people who have an emotional suffering and the risk of suicidal behavior. And somehow, since it's giving an answer to those people who have that risk situation, that suicidal risk situation, to the environment of those people who could be living that situation, someone that may be close to them who may be having that situation, and also families in the process of grief. The characteristics are not only for that to be universal. We wanted a number that was easy to remember. It's a phone that is working 24 hours a day, easy to remember. It's anonymous, it's confidential, and it has an outreach at a national level for any person that is residing in our territory. And it also is working 24 hours a day, 7 days a week. The team is integrated by expert professionals, and it has phone attention. And from last month, we started with the chat as well. We also have adaptations for people with some kind of disability or that may need some kind of translation service to give possibility to everyone with all characteristics to access it. Line 24 establishes that professionals have some protocols and they are subject to ongoing training so that we can classify calls, people who are calling, depending on the risk they may have for suicide. In this sense, there are very different kinds of protocols that make it easier for that detection. Just to give you general figures, some of them were said by the Secretary of State in this period from May 2022 until now. We have assisted 180,000 calls and 7,500, as the Secretary was said, were derived to the regional services of 112, which is the emergency number service. In Spain, it was a very high number, and it has those characteristics that actually the people who want to give their data is 30, and 38 of them is women, and 33% it's men. The rest did not specify their sex. The most likely age is between 50 and 54 years old, and the chat is mostly used by the young population. Here you can see a graph. What was very attention-drawing to us was that from 20 to 24 years old, it's a percentage that is quite high of calls, but the truth is that the highest one happens between 50 and 54 years old, and it's particularly attention-drawing with the age gap of 70 to 74 years old. Green represents women and green represents men and violet represents women. This is for some other communities. In Murcia, we have said it a lot. These are the data from Asturias so that you can see the volume of calls that have been happening. And we do it together with campaigns and policies with the media in order to improve the way in which we communicate and we eliminate stigma. Thank you.
Gracias, Pilar. Vamos a dar...
Thank you, Pilar. Now we're going to move on and give the floor to Alexander. He will be talking about how they're tackling this problem from Austria. He's going to be talking about suicide prevention. Whenever you want, you have the floor.
Thank you very much. I hope you can hear me, and I hope the slides are also here. Not yet. I will do a rush of 10 minutes through 12 years of Supra. Here are the slides. So, yeah, let's start without any delay. Supra is an abbreviation for Suicide Prevention Austria, and we have a very long tradition of suicide prevention in Austria. As you see, suicide prevention started back in 1910 and is also linked to sometimes internationally well-known persons like Viktor Frankl or Erwin Ringel, who was also the founder of the International Association of Suicide Prevention. But most of these actions were single actions and not part of a bigger strategy, and actually it lasted more than 100 years in Austria to finally come up with a national strategy called Supra, and also the establishment of a coordination center at the Austrian National Public Health Institute, and I'm head of this coordinating center. The Supra program started back in 2012. In the middle you can see that at that time Federal Minister of Health in Austria. He looks a bit skeptically. And at that time there was presented a paper called Supra, Suicide Prevention Austria, and this paper is maybe, or the whole story of Supra is maybe how I would say maybe worst practice example becomes a best practice example, because it was presented to the public as a national strategy, but in fact it was not a strategy. It was a 60 pages expert paper containing information on international papers, a meta-analysis of national suicide prevention from something about sociology, a cost-benefit calculation, 10 working areas. But actually, it was not a strategy, but a very broad description what should or could be done in suicide prevention in Austria. So the challenge was this paper did not go into details on prioritization of measures, responsibilities for implementation of measures, target goals or outcome indicators, but all these points would have been crucial in order to convince decision makers and to foster suicide prevention in Austria. And like Spain, Austria is a federally structured country with 9 totally independent regions. Some call it 9 kingdoms, but and it's very, very difficult actually to really convince everyone, and you need a very good plan to do so. So what did we do? We chose a double strategy for implementation. On the one hand, we tried to immediately do what we could do, like goals and measures that were easy to achieve, were conducted immediately. We called them quick wins or low-hanging fruits, however you want to talk about. This was like we established within 1 year a national suicide report. We organized conferences. We support local initiatives in their applications for financing. We started with a web page. We developed a concept for gatekeeper trainings, and in parallel we started to develop a structured concept for implementation together with a panel of leading experts. In Austria also we have 9 totally independent regions. We have, I would say, like only 35 experts in suicide prevention in Austria, and it was quite easy to bring them all together, and all our partners in this field, in this group of experts. Of course, experts by own experience are also part of this group. And we structured everything that was in this original concept now in a new way, and we came up with 9 columns which are the 6 columns, in which are the 6 strategic areas and 18 operative goals that should support the achievement of these 6 strategic areas. And behind that, more than 70 measures to achieve these 18 operative goals. So it's quite complicated. We also define target sizes and indicators and responsibilities. And actually we structured it according the recommendations by WHO that were done back in 2012 and 2014, structuring everything according universal prevention, selective prevention, and indicated prevention. This was published in a paper in Austria back in 2019, and we came up with these 6 pillars of suicide prevention. The first one was one pillar that we neglected for a very long time, but which is very crucial, and this is the coordination and organization on national and on regional level. Then support and treatment, the others, restriction of means, awareness and knowledge, embedment in already other existing activities of health promotion, and last but not least, quality assurance. And below that, some kind of framework conditions where a lot of other, like the provision of, psychotherapy, money for the unemployed. So a lot of important framework conditions you would need for suicide prevention. And this is now an extract of the implementation concept, especially if it's the first 2 pillars. And in gray, you can see the operative goals, and in white, you can see the measures. The whole thing would look like this, which is very long and very complicated. And of course, this is, once again, nothing you can sell to political decision makers because it's much too complicated. So we came up with a starting package. We called it starting package for suicide prevention. These are for each of the pillars 1 or 2 measures that can quite easily be implemented within 1 or 2 years. And it's called starting package because if you implement it, you really have to start for suicide prevention in your region, and you should not think that, okay, I've implemented those things, so we are happy, we have done everything. Yes, I won't go into detail on that. Maybe what's interesting for you as well is the lesson learned and the recommendations. So after 12 years of experience with Supra, it was very helpful that it was an initiative of the Federal Ministry of Health, like it gave an official frame of the whole thing. But it was very important also not only have a national coordination, but also to establish regional coordinations. This was very important, and it was very important also that the national coordination is done by the National Public Health Institute, because we are involved in so many other activities in health and mental health policies. So there are a lot of synergies for suicide prevention and healthcare and health promotion as well. Very important is to do a situation and needs analysis in the very beginning and to build on already existing initiatives. Very often we tend to reinvent the wheel. This should not be done. It's very important, what we did not in the very beginning, so this was a learning, that it's very important to have a broad involvement of all the relevant stakeholders from the very beginning on. It was very helpful now to have structured it by clear objectives in suicide prevention, target sizes, indicators. It is like this starting package. It was very important to have some kind of easy-to-eat pieces for political decision makers, like this starting package. We used also formats decision makers were already familiar with these strategic goals, operative goals, measurements. It's also used in other health strategies in Austria. And what is maybe also very important is that we learned that we should not fight windmills and that we should go where the energy is, so that we learned that it's not so important to start an initiative in all 9 regions at the same time. If one region says, we want to do that, and all the other regions say, no, we are not sure, start it in the one region, and if it works there, the others will follow. And it does not make sense to have 3 years of discussion with all the other regions, yeah, and please, and we think it should, and you should, and no, don't fight windmills, go where the energy is, go to the one region that wants to do it, And if it works, fine. And if it does not work, you know, okay, it does not work. And yes, and actually it was very, and we call this the snowball effect, actually. So if one region, and if it functions in one region, they will have this snowball effect that other regions will follow. And what is highly important, after 3 or 4 years of Supra, we were quite frustrated because we had the feeling we did not achieve anything. And then a colleague from another strategy department said, yeah, the problem is you do not monitor what you achieve. So it's very important to have the monitoring. And as we established the monitoring, we saw, okay, we reached that, yeah, oh, wow. And before that, we were really focused on the things we did not reach at that time. Okay, the key facts, I skip it, if you can download it somewhere. There are the key facts about budget and everything. What's maybe important, we heard before about the joint action implemental, and Supra is one of the 2 best practice examples with this joint action implemental. On the web page, you can find this. This is the Supra handbook, where you find all the information on Supra and also guidance on how to establish national or regional suicide prevention strategies. Okay, thank you very much.
Thank you. Muchas gracias, Alexander.
Thank you very much, Alexander. 2 countries facing in a comprehensive and cross-sectional way something that is so brutal, that is affecting us every day. It is an excessive figure, always, when we talk about suicides. We have figures in the pandemic world. In the world, we're almost in the 1 million threshold of people who commit suicide every year in the world. This comprehensive and cross-sectional strategy that also defended the European Commissioner when she was talking to us, and when she presented this project, and when we presented in Spain the first report on mental health. We believe this is the cornerstone in order to try to tackle a social problem that is multifactorial, and we can't tackle it only from the point of view of the health sector, but we cannot tackle it without the health sector. Now we're going to listen to Nel González. As I said before, he is the Spanish Mental Health Confederation president, and this confederation has been existing for 40 years, and they have a president that likes to work very hard. He really believes in this project, and he lives for mental health. You have the floor. Thank you very much, Dolores. Good morning to everyone who's here today. First of all, I would like to thank the government of Spain for the specific references to mental health in the official program for the Spanish Presidency of the European Council. Also, the different events that have been proposed, whether that has been cross-sectional or specific, as this high-level meeting is. We also want to thank the organization and the invitation to the Ministry of Health for this specific encounter, specifically in this space to try to put together concerns and claims in order to try to prevent suicide. It's a topic that, as I will say later on, it's very urgent to tackle it. Of course, I really want to thank you all for having chosen this place for the hosting of this event. This is my hometown, and we are our characteristic is being very welcoming, and we want to show that. If someone does not know our organization, we are an organization that tries to fight for the people who have problems with mental disorder. We try to work in their environment in order to improve their quality of life. Our network is made by more than 340 associations that are put together around 18 federations and regional entities, and they have more than 60,000 partners in the whole territory. In 2023, the Confederation has been existing for 40 years, and we have celebrated it by doing our 22nd conference in Spain under the topic mental health for the rights of people with mental health disorders and for your rights. We tackle many aspects as education, employment, the promotion of mental health in different situations of vulnerability, with special concern towards children, teenagers, and the elderly, who sometimes face and unwanted solitude and loneliness, and of course, suicide prevention. This is one of the most important topics for us. And why is that? Because suicide rates, both in Spain and in Europe, are very concerning. Suicide after the pandemic is the biggest public health problem in Europe. We estimate that the average of the prevalence rate is about 11.93% per 100 inhabitants, according to the WHO. There are evidences that for each adult person that commits suicide, more than 20 people probably attempt suicide. This is a tragedy. And in Spain, the latest data from the National Statistics Institute that have been published in 2022 say that suicide was once again, 1 year again, the principal external cause of mortality in our country. Unfortunately, we have had all the records in Spain in 2021. We had 2,900 men and 1,900 women. That's 1.9% more than the year before. That increased 41% with regards to the previous year. This figure should be concerning to us, should be alarming. And also, according to the report of the situation of mental health situation in Spain that we have done together with the Mutua Madrileña organization, 14.5% of the population has had suicidal thoughts or they have tried to commit suicide before. This happens more or less often among women. It's 17%, and among men, 11.7%. Same thing happens for self-injuries, because it's almost double in women. For these pieces of data, it's important for us to reflect on this. What resources do we want to allocate towards mental health? How do we want to help people who are suffering psychological problem? How can we help them doing it from a comprehensive approach? By understanding that mental health is cross-sectional to our personal situation, to our social, economic situation, and possible discrimination factors that we could suffer, such as the gender, the place we live in, or sexual orientation. In the presidency of Spain in the Council of the European Union, our country has the opportunity of putting the focus on this emergency. It's essential to give mental health the same level of dedication and resources that are being allocated to physical problems or other diseases. In Spain, there are more deaths every year because of suicide than for other cases of a lack of health, such as leukemia, and people who take their lives is more than double than those people who are dying in traffic accidents. I don't want to compare or prioritize one situation against the other, but my intention is to say that all health problems should be treated equally, because equality and accessibility are the basis of our social, healthcare, and legal system. We cannot allow for some people to receive adequate attention and some others don't, because if we do that, we fall into discrimination and injustice. It's also a matter of human rights. We have had World Day of Mental Health. In this practice, people who have a mental health disorders, do they have more or less rights than the others? Right now, the answer is painful but clear. Yes, in Spain, we signed in 2008 the Convention of People with Disabilities by the UN. In this convention, it has a binding character for all the signatory member states, and in there we guarantee the rights of those who have mental disorders, but unfortunately we still have a long way to go for those people who have signed to have the mechanisms and enough resources in order to guarantee its implementation. In the meantime, every day we're violating the rights of those people with a mental disorder. The situation is especially concerning when those people are finding themselves in an emergency situation, such as it is a suicide attempt. On 24th of October, the Confederation of Mental Health of Spain presented a report on the treatment of those people who were voluntarily hospitalized, together with the Institute of Gregorios Barba from the University Carlos III of Madrid. It's an analysis of the current situation of the matter of the social and healthcare services in Spain, and we can still prove that there are some practices of like involuntary treatments in Spain, and they are focused towards human rights, and they are violating the precepts that have been written in the Convention on the People with Disabilities by the UN. One of the most important parts of this report is to clear out what is in vital urgency, and it's defined as that situation that is exceptional or extraordinary and one-time situation that people in which people could need an immediate attention since there is an imminent risk for their life or personal integrity. They also highlight that vital urgency should be tackled and defended to and cared to from the point of view of human rights with a perspective of intersectionality in the framework of communitary attention and without giving stigma or discrimination for reasons of psychosocial disability. And as a society, we have to accompany those people in a way so that we don't get to that point. We have to work on prevention because suicide can be prevented, and we cannot delay this anymore. We are talking about people's health. We are talking about people that, as last resort, they can even commit suicide. And this is not a less important problem, and it's not less urgent than a physical health problem. From our organizations, we confirm this every day. We know also that the suffering of people can be reduced when they receive the adequate attention. Most of the times when people try to commit suicide, they do not want to end their life. They want to end their suffering because for them it is unbearable. And however, part of this society still believe that a suicide attempt is an attention call, or they can see in the people the quality of being brave or the opposite of being a coward. These are just myths that grow the stigma and the taboo. The only thing that they cause is people to take more time to ask and receive help. Some years ago, the General Assembly of United Nations passed the Agenda 2030 of Sustainable Development Goals with the unanimity of all the integrators, including Spain, and do not leave anyone behind. That's the goal of the Agenda 2030. And I want to highlight this because the measurement of the mortality rate by suicide is one of the world indicators for that report. And from the European institutions, we are being said that it's fundamental to give priority to this matter. In the presidency of Spain, in the Council of the European Union, is without a doubt an opportunity to remember that and to start working to solutions together, both from the administration and civil societies. 17th of March in 2019, Ministry María Luisa Carcedo, who is from Asturias, announced over an event that were organized by the Mental Health of Spain that the Ministry of Healthcare and the Social Well-being, they were working on creating a public telephone against suicide that's similar to 016 that had already been experienced in Spain for gender-based violence, with the goal of improving the attention towards this serious problem in public health. From that moment, we started to feel that one of the main obstacles that we had as an organization, one of the main goals that we had, which was to be heard, was being accomplished. It's a resource to help people in a limit situation, but we have to keep on taking steps towards prevention. That way we will lower the figures that we said before, and that way we can reduce the suffering that each one of them is having. Because behind each number there is a person, and that's why I wanted to claim that this model of attention that has been materialized in a resource such as the 024 phone number, this should be replicated in all European countries with the European funds by the European Union. And Spain is one of the first countries in Europe that has started a public telephone of these characteristics. This is the way that we have to keep on exporting to other places, and this is the way to keep on giving steps towards suicide prevention, especially allocating resources so that we can continue with this prevention. In this sense, there are many measures that we can take towards public administration, and from the Mental Health of Spain, we will keep on working and doing our role as a collaborator entity for the state for anything that might be necessary, as we have done so far. By being part of the counseling unit from 2022 to 2026, we have strategic line number 3. The directors talked about this before. By the early detection and attention to suicide behavior from Mental Health Spain, we want to use all necessary resources in order to try to keep using this line for all resources necessary, because without the necessary resources, we can't do anything. The system has to help people the way they deserve to be treated. We need to be equal. And how do we do that? Last 9th of June, I had the opportunity, together with the professors from our entity, to go to a presentation by the European Commissioner for Health and food security, in which we presented at that time what had been just published as a document that is a new global approach for mental health. It was a very important declaration that talked about advances in the attention, in the care, and it would have a respectful response that would avoid to generate even more trauma with each institutionalization by avoiding obstacles and increasing empathy. It's essential to have training for healthcare professionals that are helping people with suicidal risk. We need more resources and political willingness so that all this can be actually done. The social system and the healthcare system has to create a care network for support and attention to the people who need them, also with attention with their human rights, so that we can do it fast to mitigate the negative effects. Also, we have to have policies for social and public healthcare so that we can have enough economic, material, and personal resources so that we can avoid and predict suicidal behavior. It's also important to raise awareness on the transcendency of suicide so that we can give orientation to those people who might be in a situation of risk. Also their family and their friends, so that they know how to give them the best effective support in those moments that are so complicated for them. And for societies as a whole to know the alert signs that can make it easier for prevention and detection. As I said before, there are still myths and wrongful ideas that are associated towards suicide. In order to end them, we have to push for campaigns, for awareness campaigns that end stigma and blaming suicidal behavior. This way, we can help people to ask for help. Lastly, we could favor the media to follow the guidelines of the World Health Organization with regards to the diffusion of information on suicide in a responsible and adequate way. We already have tools that are at your disposal, as a document that has been done by the ministry, in which there also a collaboration by Mental Health Spain for recommendations for the treatments of suicide for the media. I'm going to finish up. I'm going to finish up my intervention by saying that all these proposals are pieces that are part of the puzzle that is very complex for the suicide prevention. They are all important and strategic, and I hope that the awareness that is being done in the society right now works so that we can start putting them into practice, so that Spain is also a part and that is a promoter for that change. Thank you very much.
Gracias, Nel.
Thank you, Nel. We're going to continue in a much brief way by doing an exchange of interventions with regards to this that we are tackling, which is suicide prevention. Alexander, how do you work in Austria with filters? Filters that allow you to detect suicide and suicide behaviors in order to try to prevent those situations. So somehow we can try to decrease that problem, which is suicide behavior. How do you work with those filters?
It's a good, it's a good question. Actually, what we are trying at the moment, especially among young people, to really talk about mental health problems, or even if you get the feeling that a close friend or one of your family feels unwell, not even talk about her problems or his problems, ask him what is, do you have problems, do you want to talk about something, and simply by asking and talking to the people, find out if you can support them somehow. And we have a webpage for young people, especially with a lot of videos showing how you can do that and how easy it is, and also videos from people with own experience of suicidal thoughts and suicide attempts, how helpful it was for them when they were asked for the first time, do you think of doing suicide? And that this was the first time that they did not dare to speak about it, and it was so relievful for them that they were asked, and then they can all talk about it. So this is one approach of many, but I think this is, for me, it's the most interesting approach, because we had some 10 years ago, we had as a guest Kevin Hines from the United States. It was a guy who jumped from the Golden Gate Bridge in San Francisco, and was one of the few survivors of this like 70 meters falling into the sea. And he told us at the time that his major problem was that he never was asked, and he was always, and he was not able to talk about his mental health problems. And the first time the doctor asked him, or a friend asked him, it was such a relief for him that he can now talk about it. And so was one of his key messages. If you feel, or if you see a person crying in the street or in the public transport, why don't you simply ask them, hey, may I help you? So, yeah.
Gracias. Pilar.
Thank you, Pilar. In Spain, how do we anticipate this 024, which is the phone line that was already included and was presented in the 2021 mental health plan? This phone number serves as a measure on how to act on those filters, because if those filters acted before in health and education and social services, then we would have a lot of calls that we wouldn't receive. What do you think about this? Well, I agree with my colleague Alexander. I think that it's a very good question. It's very hard to answer. It's a great challenge, and we have a long way to go, and we don't have all the data of all the suicides and all the attempts and all the tools that we have in the Psychology Institute that show us the data of suicide attempts in earlier ages. So just like you've talked about before, we have to work on all the centers where people are, and especially with people that are at risk. We'll have to work on our social media so that we could get rid of that stigma and talk about suicide, which is a topic that we shouldn't hide. We don't have to hide it. It's something that we should talk about with the people that are in our environment. So, of course, we have some responsibilities in different sectors and some actions that we take. In the healthcare system, for example, we're working on our work group on a task force for kids and adolescents at risk for suicide. We work on primary care, we work in different sectors of the healthcare system, and we try to consult and prevent those suicide attempts. So we also work with the education ministry, and we also work in different schools and different high schools to see how we could act via different people and agents that are specialized in schools, and to see how they tackle the fact that some kids or some teenagers are not okay, or due to bullying, or due to the fact that they're failing school, or any different problem that they might have. So we have to detect those people that might be at risk and see what happens and how we can prevent. So we also have surveys in universities, so we can see what's happening in those spaces to see those behaviors that are linked to suicide and work on them. And finally, we also work on at a professional level. We look at the internships, we look at the different companies and see if there's some sort of bullying or harassment in the workplace. And we work with different sectors, and we work in a cross-sectional level. Well, now that we've talked about the media, you all have talked about the agreement with the Spanish television in Madrid to do some sort of programs in TV. What's the goal here? Can you explain the goal? Well, it's very important to know that the media wants to collaborate and contribute to the well-being of people and also their mental health. So they asked us to give some orientation and some intervention. In Netflix also, they asked us to do this. And what's important to us is to be useful and to be able to guide and help those those decision makers and those creators, and also be able to say clearly that everything that's happening and that could be prevented has a lot of factors, but it's something. But what's important is to be very delicate when talking about the emotional state of people. So we have people that define well-being in different ways. So we could talk about economical well-being, physical well-being, material well-being, and also spiritual well-being. Well, we're all human beings here. So we have to talk to influencers and see how they could educate people and improve well-being, and tell the people that well-being and mental health is a right for people. And thankfully, we're able to influence the people that ask us about this topic, and we want the efforts to multiply. Well, Dolores, you already know about this. You've been a person that has worked on this and is deeply human in its in your approach. So Pilar Aparicio has worked on this also, and she's talked about the data, but this is not data. These are people. We're talking about feelings. We can improve that. We can improve that with a smile. We can improve that with a hug, and we could be nicer on a daily basis. Well, yes, that's right. Let's talk about suicide. We've seen that 8 people are linked to the people that commit suicide. That's an average number. So our situation is very severe. We're going through this grief. And I don't know what you think about this. How do we take care of this? How do we work on this care for the survivors, suicide survivors? Well, thank you for that question, Dolores. Mental health in Spain is very important. We sometimes find ourselves with the reality, with the human reality. We find ourselves with some pain that we don't know how to focus, like refocus and recenter. So we have to, we work as a network with resources from all over the country. Any association of ours has all the resources to get closer to people that have been through a suicide attempt, from on a professional level and also on a personal level. So I'll give you some data. For example, some years ago, we signed an agreement with the Mexican embassy. Mexico has 86,000 people that live in Spain. So what we did was an agreement so that this Mexican population could go to our resources and could ask for help like any other Spanish citizen. So it's a shame because other countries don't want to work with us on this. So, for example, some countries from Africa have a different way of working. So we always want to try to create that link with countries, and we want to give equality. So it doesn't matter if it's someone from Mexico, from Congo, from Austria, we don't care. We just, like Alexander, for example, everyone will be treated equally. So yes, it doesn't matter if they speak a different language or or they come from a different country. So the stigma is bigger depending on the country where it happens. So in the rural population, there are a lot more suicide than in the city. So the stigma is bigger in those regions. So the people that are left behind when a loved one commits suicide, and we live in a farm, the pain and the shame that we feel and the guilt is bigger than if it happens in the city. So this is often forgotten because people think that living in smaller communities makes it easier to go through these painful situations, but that's not true. The stigma is higher and bigger. So what makes it a lighter pain, is the physical damages, but not the psychological ones. So when someone commits suicide, people criticize it in the rural regions. Alexander, we know that in Austria, in Supra, and in your department, you deal with and you fight against that stigma of the media. And that's a pillar that's fundamental.
Linked to somehow some kind of tradition in Austria. We have a research group who really only works on suicide and media, and Thomas Niederkotenthaler and his team, and they were the people who found out that there is not only the Werther effect, that the copycat suicides, but also the Papageno effect, that you can report on psychosocial crisis and how to overcome it and to solve those problems and how to give hope to the people. And so this is one of the pillars of we established 5 years ago a media prize that is called a media award, actually, that is called Papageno Media Award, and it's called after the person Papageno in Mozart's Magic Flute. And every year this prize is awarded by the Federal Minister of Health to one or two professional journalists who wrote stories of hope, of how you can deal with severe mental health crisis and how to solve suicidal crisis and how to survive. And this is a very important thing, and we are working on not only having this event once a year, but to have also more media reporting on that during the whole year and the month before and the month after. So this is what we try to do.
Well, thank you for your work. Thank you for your work, Pilar. You've detected that the stigma and the lack of information has made it harder to work on the filters. So now I'm thinking about social services, I'm thinking about also the primary care doctors, and also about professors, because all of us, unless we're acting in a voluntary way to break the stigma, we're seeing that the stigma works. So if we don't have enough training and enough clarity or breakage of myths, we'll see that present in front of us when we see a patient, a student, or someone that we care for in social services. Have you detected that in the 024 phone line? Yes, we have seen that this filter exists, this difficulty exists. And as you've said before, in smaller communities, difficulties are bigger and higher for the survivors and the people that have lost loved ones. Well, the fact that nowadays people that have went through and suffered suicide attempts or have loved ones that have gone through that or work in that sector or work in media, just like you've said before, well, like for example, in the media, we see that in Spanish TV, we see that every once in a while they show a hope story and to help people, and they share that knowledge. What we have to try is to give visibility and talk about this topic in the media, with the help of the media, which is an essential work. So thank you to all of those that make it possible to talk about this topic. So let's not spoil the fun. Let's, if you Google it later on. Yeah, Pablo, I'll be done in a second. I saw you. Well, if you look it up on Google, you can find news on suicide, You can find it in the Ministry of Health, or you can find it also in public television. And to finish off, the World Health Organization insists that we transmit this message, which is that suicide can be prevented. So I'll ask each one of you to give an argument about this, or a strategy that is implemented, or a project that could make it possible to prevent suicide. Well, go for it. Well, I'll just talk about the 024 phone line that we've already talked about. I think that it could help break that silence and help us listen to people. Alexander?
Yes, the whole Supra is a multi-level approach, and actually, my message is there are multi-levels and multi-approaches you can choose for suicide prevention, but you simply have to start with one, or 2 or 5 or 6 or 10 or 20. So.
Muy bien. Nel,
Bueno, yo tengo que decir,
Well, I have to talk about something that's bitter. It doesn't serve anything to have the good, the action of the society if there is no action from the government. So it's important to have both, so that we could, so the action could be more effective. We have to have a policy, vision, and a global vision to improve. Well, just like we've talked about the framework, we've talked about the European framework, and we've highlighted it. So we finished this panel by thanking you for your work, and let's prevent suicide together. Thank you.
Muchísimas gracias. Ya lamento ser
Thank you. I'm sorry for being the villain of the story, because I'm always there pressuring you about the time, but I have more people that want to get to the stage. So thank you very much for being here with us, and it was very interesting. Well,
documentary I told you about in the beginning is going to the schools and talk to the students about mental health. Because you go there and they start to ask about different things. We usually go there and project some part of the films, and we talk about the making of, our feelings when we were making the documentary, and you are able to see they know very well what they are talking about. And possibly they know people who are suffering a lot, or maybe they are just suffering a lot, and they are interested in that. I remember specifically one day, we were in Granada, a beautiful city, by the way, if you don't know it, where we celebrate some weeks ago the Council of the European Union. We were there in a small town really close to Granada, and we were talking in a school. We were talking for more than 2 hours, 2 hours and a half, and it was the last hour of the day. It was the end of the day. And well, suddenly the bell rang. It was the end, and nobody moves. That was surprising for me, because we usually go out so quick. So nobody moves, and the hands were up. They wanted to talk more about that. Y para nosotros fue.
so for us, it was very surprising to see that the professors had to tell the kids, hey, that's it, we have to go, because they really wanted to keep talking about the documentary and talking about suicide. So they came to us and they told us that they have talked about a lot about sex, about drugs, but no one has talked to us about the suicide. And they know someone that is going through a very complex situation that is identical to the one that we've seen in the documentary. How can I deal with it? How can we help? And we become psychologists, which we're not, because we're always repeating this. We're just specialized in this. We just tell the stories, and we are not psychologists. We always recommend people to talk to other doctors. And what scares me, and it's something that happens one time that we went to this high school. And, we didn't pick these kids, these young kids in a random way. They wanted to come. So we sat with them and we asked them about mental health and if they have thought about committing suicide at some point in life and why. So out of the 8 or 7 adolescents that were with us, half of them said yes, and they explained why. When we got out of there, the professors were scared and they came to us and said, "How is this possible?" So what's shocking me is that professors spend every day with them and don't even realize that something that they asked us when we barely asked them about for 2 questions. So clearly we can change certain things in the education systems. So that's what we're going to talk about. We're going to talk about mental health, about young people that are talking a lot about it on social media. I mean, we can welcome them to the stage. We can welcome the panelists that are already prepared.
De jóvenes va prácticamente.
And when we talk about mental health and teenagers, it goes hand in hand. So the first protest for mental health in 2021, we could see that most people were young in that protest. And, young people are very linked to mental health and to social media. So that's why we wanted to focus on that. This panelist will have a moderator, high-level moderator, who's called Celso Arango, who is director of the psychiatric and department for teenagers and kids in the Hospital Gregorio Marañón in Madrid. And he also works as a professor in the San Francisco University, and also a professor in King's College, and also a professor in the University of Madrid and more. So Professor Arango focuses on neurobiology and psychosis and psychopharmacy of development. He has received more than 65 prizes for his work. So welcome, Mr. Professor Arango. Well, thank you, Pablo. Mel Brooks used to say that it's great to be king. But I'm saying that it's great to be moderator, because who moderates the moderator? Who defines the time? Well, it's been a pleasure here.
Share this session in my native language, so I will do it in Spanish. Y tengo que decir que me alegro de hacerlo en español porque venía pensando en el avión.
It's a pleasure to speak in Spanish because it's a pleasure to come back to my land. And how do we say land in English? Well, I could see it. I wanted to thank you. I could say it in Bable, which is the Asturian language dialect, and I wanted to thank the Ministry of Health for inviting me here. I have a lot of respect for all the people that work for this Ministry of Health because they have done so many great things for the country. I just wanted to start by 3 key messages before I get to the highlights of mental health in teenagers and in kids. So, first of all, COVID-19 didn't affect everyone equally. There were some groups that were vulnerable, that have been impacted severely, like women, kids, and teenagers. And probably you don't know about this, or a lot of people don't know about this, and that talked about mental health for a long time. They could think that in kids and teenagers, mental health disorders have came with COVID-19, but that's not true. There has been an increase in kids' suicide, and it was growing before the pandemic. So the third fact, and the essential fact, is that we have to remember something, that every time we hear about, we are surprised. It's the fact that these symptoms starts in infancy and in adolescence. So from 10 years old to 30 years old, disorders, mental health disorders, they produce a lot of loss of years due to disability or death than the rest of pathologies, all of the rest of the pathologies. So we're in a segment, in the damage segment, where we see that people are young, and when there are mental health disorders, we find ourselves in this situation. So without further ado, let me give the floor to Maria Jose Platero, who works in pedagogy, and she works as a president in UNICEF in Asturias. And she is accompanied by adolescents of 13, 14, and 16 years old. And that's the best way to talk about adolescence, by giving the floor to adolescents. Well, thank you very much. 1 out of 17 adolescents has a mental health disorder that has been diagnosed. 1 out of 7 kids. So the crisis that we're living through, which is linked to work, climate change, and others, creates an additional pressure on their well-being. In UNICEF, we support the institutions so that mental health can be a priority in policies. We celebrated in June a conference about mental health where we focused on kids and teenagers, and we hope that in the future conclusions of the council, this institution can follow the same line. We think that the way to deal with this topic is thinking about it in a cross-sectional way, in a politics way, and others. We have to focus on families, on the kids and teenagers when we talk about prevention, early detection, promotion, and others. We have to follow the strategic line of the European Union that recognizes the role of those that work in healthcare, including primary care, education, kids protection, and also refugee reception and protection. So we also have to reinforce the role of educational centers, and we have to focus on teenagers and kids due to the fact that suicide in teenagers is one of the 2 main causes of death in that range of ages. So we also have to have an environment with people that are competent, that are adapted to the kids, to the teenagers, that are at risk, like refugees, like kids that have disabilities, and others. We also have to include mental health in all politics related to cooperation with other countries and in the European Union. These are our lines of work. In UNICEF, it's important to promote the participation of kids and teenagers in our policies because these are one of the 4 pillars that we have in kids' rights, children's rights. And that's why we want to give the floor to Irune, Greta, and Carmen. There are 3 children that are part of the Council of Aviles for mental health for children. Because we want you to hear from them about mental health problems related to children.
Ministerio de Sanidad por hacer lo posible.
Thank you to the Ministry of Health for doing what's needed, and thank you to Greta, Carmen, and Irute for being here with us. Thank you.
Soledad, presión social,
Solitude, social pressure, stability, therapy, well-being, confidence, help, balance. We're Irune, Carmen, and Greta. We come to represent the Municipal and Regional Council for Children and Teenagers in Mental Health. Every day, our brains process a lot of emotions. There are a lot of emotions, so many emotions that we cannot even find the words to describe them. That's why the children and teenagers from the Council of Avilés, we had to create a dictionary for our emotions. With this dictionary, we try to define new emotions, like the nervigria, which is when we're nervous because of something that makes you very happy. Tristorial, which is when you're sad, when you don't like the dreams that you just had. La liberación, which is when you feel relieved because you're no longer in tension. And this way, we understand that everything that happens to us, even if we don't know how to describe it, is important. We understood that it's normal to feel bad or feel sad, nervous, happy, worried, etc. But what's important is to be confident enough and feel and trust the people that are around us to talk about our feelings. A lot of times, when with children and teenagers, no one listens to us. So unless we're in tears. So why are other emotions questioned?
Necesitamos que la salud
We need mental health to stop being a taboo. We need to express ourselves freely without being judged or receiving answers like, "Oh, these things are stupid," or "It will pass." We need to have help. If we don't get help, then how would we express ourselves with other people in our environments? About safe spaces, we have a lot of laws that prevent physical violence and also focuses on the creation of safe spaces to prevent emotional violence. We value and we applaud this law, but when we were in a council analyzing this law, we found out that we didn't understand anything about it. How is it that a law that is focused on on teenagers and kids is written in a language that is not even understood by adults? So last year, we decided to adapt that law with a language that is more easier to understand by kids and younger people. We created stories, we created designs to illustrate the meaning of this law so that everyone can access it and understand it. In the sectors that this law acts is one of the sectors that this law acts in is the education. Education is important for our mental health. If all schools and high schools are a space where we spend the most time and we develop as people, why do we look the other way when kids and teenagers suffer and go through desperation? They feel pressure to get good grades. They feel minutes and hours of tension and silence. They are threatened by being let go, or they feel also exclusion and solitude. These are feelings that we feel in our high schools and education systems. So what happens is that instead of learning, meeting each other, growing as people, we feel anxious, we feel solitude, and we don't feel good. This has to end. We don't need very complex things. We just need simple actions and game days to take the kids out of their screens and let them play together and talk with each other. So this should be implemented in all grades. We should implement this at the beginning of each class so that we could improve the kids' and teenagers' mental health and protect it. Being a part of this council has helped us to understand Avilés as a society and not only as buildings and roads. So this is what we do when we think about everyone's well-being in Aviles. If we take care of our city will take care of us. In this way, with different small actions, we can create small islands where our mental health is at peace and safe. And if we feel that in all the spaces we are being heard and we are being taken into account, we'll see new positive things, because the problem is not being a teenager. There are things that happens to us inside our brains. We want everyone to hear us and listen to us, just like everyone. Thank you very much.
¿Sabéis? sa- ¿Sabéis lo que os digo, Irune, Greta y Carmen?
You know what I think, Greta, Carmen, and Yurune? I think that you did a great job. It's top. It's great. So it's phenomenal. Great.
Muchas gracias. Muchísimas gracias.
Thank you very much for sharing. Well, I think now that we have to start with our next speaker, who is a friend and a colleague, Marisa Lázaro. She's a psychiatrist, and she works in the Hospital Clinic in Barcelona. She also is a professor in the University of Barcelona, and she has been also president of the Psychiatry Hospital for Kids and Teenagers. Well, thank you very much. I wanted to start by thanking General Directors of the Ministry of Health for inviting me to this event, and also thanking them for their presentation. I'm very happy to be in this panel. We're not very used to coming to this type of event, so I congratulate everyone and congratulate myself for being here. I want to talk about the actions that we take in mental health for children and teenagers. And during recent years, we've talked about the effects on mental health in children and teenagers. So one thing is hearing about it in media, and whole different thing is to read about it in research papers and scientific research. After COVID, it's true that, just like you've said, Professor Arango has said, we already had some mental disorders, but some groups have been affected, and like, for example, kids, women, and people who have neurodivergent problems. And we've worked with them on creating relationships with their families and positive reinforcement, and having a great network so that they can improve their health and their emotions. So we should do more than that. We should think about the psychosocial adversity that children deal with. So we've also seen that there are a lot of adverse things that happen to children and also to teenagers, and that is seen in the research papers. And we also have seen that people that come from a lower social status have more disorders and lower grades and a worsened physical health. So I also wanted to give some context about mental health in children and teenagers, and talking about the effect that is very complex, that is due to the social media and to technology in general. So let's talk about the strategic lines that are related to mental health.
2026, la
Let's talk about the fifth line that is related to how to deal with problems in mental health in context of higher risk. One of the groups that are at risk that we focus on is children and teenagers. The strategy has three goals. The first one is promoting mental health in kids and teenagers. prevention and early detection of mental health problems in these ages, and also to focus on goals that are more specific, like promoting in education factors that protect from the stigma, from social problems. We also have to develop some programs and protocols in the education sector, health sector, and community sector, and also incorporate some procedures, some testing procedures to find those people that are, or screening procedures to find those people that are at risk of depression in teenagers and kids. The second general goal is care for kids, for children and adolescents with mental health problems. So we have to focus on early detection of severe mental disorders, and we also have to elaborate some programs of continuous training for some for doctors, for general practitioners, for nurses, and primary care nurses that work on depression, etc. We also have to promote training programs for professionals and also respect the fundamental rights of children. Finally, the third goal would be to fight against discrimination and stigma, social stigma of kids and teenagers by creating programs and campaigns that contribute to this fight. On the fifth line, we also have some guidelines, and I'll highlight only three. We have to create specific training to detect depression in kids and teenagers. And we also have to adapt the budget so that the communities that spend less on mental health can get closer to the average of other communities. And we also have to develop specific units dedicated to mental health. When we talk about how to deal with mental health disorders in contexts of higher risk, what we've done is create a task force that is cross-sectional and multidisciplinary. We created a guide of schools that promote health. We also created and developed training actions for the education community, and also created specific actions against abuse, violence, and mistreatment. And that way, in 2022, we started this task force that included professionals from the Ministry of Health, Education, and professionals from different entities that work to protect the kids, for example, Save the Kids, Save the Children, UNICEF, etc. And we also had the Spanish Federation for Mental Health and a lot of scientific societies that have worked in mental health, psychiatry, for example, psychology, dedicated to kids and teenagers, and family medicine and nursing. So these are all the members that agreed on a lot of points. For example, who should the frameworks that we should work on. And to take the patients to specialized care and not leave them in general care or primary care. So we also agreed on the need of having professionals that were trained in how to deal with kids and teenagers, and also family medicine. It could do rotations that were linked to mental health. So we divided it in different groups to be able to focus on two goals. The first one is to incorporate screening procedures that could be simple. It could identify depression and also identify those teenagers that could come to
primary care for mental health reasons. The second goal would be to create programs of continuous training for primary care. This task force went through a slow development. So right now, they asked each community for documentation about the work that they're doing. They also analyzed the data, and they created documents with guidelines that are very specific that would be approved by each autonomous community, and that could implement it in the future and assess it a year from now. So to finish and to conclude, I wanted to share with you some thoughts that I tried to share with the Journal of Children and Teenagers mental health disorders. So what I tried to do is to communicate the importance of what to prioritize in children and teenagers' health, what we can expect, and what is mental health for teenagers and children based on in a specific moment in time. For example, the one that we're in, we're talking about a different time. It's not the same thing to be in this current time than to be in the 20th century, for example, or a different time. So when mental health is lacking in teenagers, what we will see is a lack of good functioning, good psychological functioning in adults, in future adults. And that will be a problem that will occur in our society.
A todos los niños y adolescentes que tengan problemas.
Also, instead of just helping teenagers or children, we have to work hard with those vulnerable populations. That's also children of parents who have mental disorders, children who have received also harassment, and for these challenges for present and the future that we are setting, we can't only remain at prevention, but we also have to try to optimize to the maximum the resources to help children and teenagers who already have some problem, and to help them, as we have said over the morning, with a more communitary service with professionals that are multi and interdisciplinary, and especially with an intense collaboration with other fields such as the social field, the educational field, and the field of justice. I just wanted to say, and I believe we all agree in this, that mental health and trying to work towards children's mental health and treating mental disorders in children is what we have to give, so that all together we can try to create a more fair society. Thank you.
Han visto ustedes, ¿no?, que les he dicho a las tres
You have seen that I have said the 3 teenagers that they had 10 minutes and she had 9 minutes and a half. I told her that she had 10, she is 12. We are continuing with Ana Lorda. We have heard Luisa talk about population and risk of discrimination, and now we're going to be talking about children who are refugees and they are in situation of risk. She's a lawyer. She has the master's in law that regards European and international law related to human rights. She's also a specialist in everything that has to do with migration and refugees, and she works and she represents Save the Children. So, Ana, you have 10 minutes. Good morning. From Save the Children, we want to thank you for the opportunity for this encounter to talk about a problem that actually concerns us as an organization, which is mental health of children and teenagers, and most specifically, mental health for those migrant and refugee children, which is a collective that has been especially affected by mental health problems. In this brief presentation, we're going to be tackling key concepts that are related to this topic. We're also going to be talking about risk factors that affect migrant refugee children, the impact of migratory European policies on these mental health problems, and how we work towards with institutions in the member states. First of all, we have to be talking about migrant and refugee children. There are many terms that are used for this collective, but basically it's children and teenagers that are displaced in their own country and also to other countries for many reasons. Could be trafficked children, could be children who are not together with their families, so they're alone, they're separated from their families. They are in a situation of living in the streets and they are dependent, asylum seekers, refugees. So I'll cover both children that are migrants for all these reasons, but also those who are under the umbrella of the Geneva Convention for the Statute of Refugees, who are protected by international protection.
Factores de riesgo que afectan a la salud mental de la infancia migrante.
Before talking about risk factors that affect this collective, I wanted to talk about two concepts that are related to this collective with regard to mental health, which is the triple transition, which would be constituted by three elements, which are a transition from being teenagers to adults, happens in human development, but also transition related to migration, which is that the attachment and that need to create a new life in the host country. We also have the transition related to overcoming suffering and all those traumatic events that the child has suffered over the migration process by fostering this new feeling of emotional well-being and also a double absence. Very often, all these people that leave their country of origin, specifically children, they can experiment this double absence because it's both the absence of their country of origin, so it's the separation of their family and their loved ones and their social environments, but also they can experiment an absence and they can feel absent in the host country because they face challenges such as stigmatization, discrimination, feeling of non-complete belonging. This can lead to feelings such as loss of identity, deorientation, and the lack of belonging and purpose. Well, here we will see the main risk factors for migrant and refugee children's mental health. It's not just a closed list, but what we have to take into account is that all these traumatic events that have been lived both in the origin country and the transit and the host country, they can induce or exacerbate psychopathologies, and they can also affect very negatively both physical development and emotional development for children that are migrating or refugees. We can divide in three big fields, which is the host country. As we can see in this list, that most of these children have been exposed to family accidents, previous situations such as political or social conflicts, who are the fruit of social or civil wars, threats, persecutions, child labor, destructuring of the family, lack of structuring in the family links or social links, insecurity and fear as obstacles in the access of structures for healthcare or education. In transit, many of the ways to get to Europe are not legal. There are very few legal and safe ways to get to Europe. Very often these children have to use ways in which violence, abuse, and trafficking are common problems. Very often the access is very limited to basic needs such as food, drinkable water, etc., medicines, and this could cause a lack of references. There could be a separation from their families. In these transit countries, there could be stays in macro centers or host centers that are not adequate to assist these migrant refugee children, etc. We also have all those risk factors in the host country as well. Here we have a hosting process, which is key in the situation of that, the excessive red tape and paperwork, which could create a lot of insecurity in the people, and also the stress for not having any culture, which is the difficulty of adaptation for the new culture and the conviviality system. Also things related to religious beliefs, values and stereotypes, prejudices and racism, just like I said before, affect here, and also the conditions of hosting these children have a very negative impact in their mental health. What's the role of the member states of the EU in this topic? Children are fleeing these violent situations. They are in very traumatic situations, but policies and the violence that they find in many countries in the European Union and outside of the European Union, the hosting conditions can worsen mental health for many children. Here you can see two reports that we have published recently about hosting these children in Europe. And this is an analysis of these conditions and the impact on their health and also the recommendations we do. How is the impact of these policies in the transit and the trip and hosting of these children? First of all, as I said before, with the common ways that are safe and legal are blocked, many of the children and their families are forced to using ways that are not safe. We have all seen images of dangerous boats, people trying to cross fences, and this is daily situation for many of the children that try to get to Europe. These trips are more and more lethal, and they are more and more dangerous. We also have return in urgent conditions. It's a possibility that happens in the Spanish current law. In 2021, in May, there was a very important case of children that were migrant. They tried to cross the fence in Ceuta, and they were returned without a legal procedure to the borders police in Morocco without any kind of process. And in this situation, it's very common for children to suffer a lot of violence, for example, at the Balkans route and also in Ceuta and Melilla. We also have problems related to detention and problems such as the hot pots in Greece and the Greek islands. There are a lot of people there, especially children and teenagers there, waiting to try to cross to Europe, obviously in disastrous situations. It's also important to highlight that the Pact on the European Union for Immigration and Asylum that is currently being processed has an accelerated process that could create a determination of asylum for international protection that could lead for children to be arrested in host centers for an excessive period of time, which is obviously negative for their mental health. We also know the family reunification in many of the countries of the European Union is basically impossible due to different requirements, such as rent. The people who are in the European Union who want to bring their families there, and they need many there's a limited access to the condition as refugees, and they could be protected under the Geneva Convention for the Statute of Refugees, and they can't be that because the acknowledgement rate for the situation is very low. In Spain is one of the countries with the European Union with the lowest asylum seeker recognition. That's lowest. There are many children who could be recognized in this situation, but they can't be because of the long paperwork processes that they have to undergo. Several studies that are being done on children's, migrant and refugees, children's mental health prove that it's a population that has a prevalence of psychiatric diagnostics and problems that are higher for those children who have not migrated. So that's characterized by mental health problems with syndromes or disorders with somatization of physical disorders like paralysis, altered movement, depressive symptoms, anxieties, disorders related to stress, responses like PTSD, alterations of sleep, impulse situations, and the use of substances is also common as a way to deal with that pain that they suffer. These studies also show that it's never too late in order to tackle the problems that migrant and refugee children have, and the recovery in an environment of an adequate protection with spaces for playing, with accompanying love and emotional support. They can redirect these situations so that it's not so serious to have this impact. Here you have, for example, a report that has been published recently. We all know the situation that's happening in Gaza, in the Gaza Strip, and we can see that 77% of the children in Gaza feel sadness or depression, and almost 80% have feelings of grief and feeling fearful. Finally, the different recommendations that we do. Here we only wrote a few because we don't have enough time. But first of all would be to stop at the arrest of children in Europe, to stop the use of hotspots, the use of host centers and micro centers, and also to have procedures and the borders that are friendly, so that all the children that are coming alone or with their families, so that they can be identified, so that we can have a proper assessment of their ultimate well-being. Also, in this sense, what we propose is so that we have programs for the transition to adult life for those people who are about to turn 18 with regards to the access of education or employment. Also, the systems for the protection of children have to be duly specialized. We also have to have host centers in which we should have people who are trained in tending children and teenagers. It's also very important to have the psychologist here in these spaces, and mostly as a recommendation of the countries in the European Union, in the host countries, but also if it's possible in the transit countries, such as, for example, those countries that are in transit, such as Greece, Hungary, etc. And also to make it easier for the accesses of permits of residence and asylum, like eliminating the criteria that sets the country to which they arrive as the prime country to decide their situation, and also to try to help all the children and migrant and refugee children that get to the European Union. Thank you very much for your attention.
Muchísimas gracias, Ona. Tendremos oportunidad de...
Thank you, Anna. We will have the opportunity of talking about it later on, many of the aspects that we have talked about. And we're going to end up of the first interventions with Pau Roig. He's also a speech therapist, and he has a master's in education from the University of the Balearic Islands. He has been trained recently. He has had the opportunity of living very closely how the European Union works in Brussels in a stay that he has done there. So, Pau, you have the floor.
Vale, yo la verdad es que...
The truth is that what I thought about this intervention is trying to claim this generation that maybe more than one person in this table belongs to, which is the glass generation. It's a generation that complains. It's a generation that talks about their emotions, their feelings. It's a generation that starts giving names to these feelings, to this lack of well-being, and we don't only name them, but we consider that it's not okay to feel anxious every day. We believe that it's not okay to feel overwhelmed every day. More than one person here is part of this glass generation. In the Council of the Youth in Spain, in this case, me as a representative today, we are very proud to be part of it. Because, come on, we're part of the generation that we say openly that we have anxiety, that we go to a therapist, and we don't, or maybe we don't go because we can't afford it, but we are part of this generation. And now, moving out to the most, let's say, dense part with data and all that, also to give realities or to give numbers to this class generation, I'll go on to say a series of reports, especially from the Ministry of Health, from the Reina Sofia Center, that we are going to be helping us to understand why this generation has earned this name. Because in the end, 2 out of 3 young people have manifested to have had mental health issues. And it's not only that, but also this reality has been worsening progressively from the pandemic, and we have talked about this. Mental health has been set into the focus. And also, I'd like to say that young people have helped so that mental health has been in the center. Also, starting with the previous roundtable, I wanted to stop a little bit on suicide because the main cause of external mortality in young people is suicide. In the Balearic Islands, which is where Zenzo and I are from, 1 young people commits suicide every month. So 12 young people lose their life due to suicide every year in the Balearic Islands. And we are going to create a distinction between genders because suicide is mainly masculine, facing other mental health realities, which is mostly that are feminine or mostly expressed feminine, such as food-related disorders are mainly feminine, for example, but suicide is mostly masculine. Women are a big part of the people in charge of having put mental health into the focus in young people. They are the ones who say in a more easier way that they have anxiety, and it's the ones who ask for help in a more easy way. But when asking for help, you also have to take something into account. 1/3 of young people that manifest having had any kind of mental health problem does not ask for help because they can't find an environment to ask that help to. And let's also take into account that when we ask for help, we don't ask for help to a family member or to a teacher. We ask for help to our friends, to our equals, to our peers. And also, as an advice, I wanted to make a claim for that need of safe spaces. Because asking for help to a friend is okay, but it will have more or less the same resources that you will have. And we need for people who have more resources, more experience to be helping us in this reality of mental health. And when we ask for help, who do we go to? 1 out of 4 can go to the therapist. Why, mainly? Because we can't afford it. In Spain, we have a very important deficit of therapists and psychiatrists. We don't have enough national exams and positions for them. And each and every center of primary care needs to have a psychologist that can help us do a follow-up to know our realities in mental health. And in the end, that primary care center that you've been to all your life to do your checkups, physical checkups, they should also be able to cover your mental health because you could have a mental health problem at any point in your life. And unfortunately, if you're not in the risk of suicide, it is very hard to have that attention and that care and a follow-up in Spain. And also, using this information and what Celso was explaining at the beginning, the reality of mental health and the mental health problems in Spain also has a component of class, of social status. And that is very important. Just to sum up, the people with bigger mental problems in Spain are people who are mainly women from a low social status. We need public tools to help us revert the situation. We need tools to accompany people so that we can transform this reality, but we mainly need safe spaces. We need to have promotion from public centers, from primary care centers, in which we have always been, so that little by little we have raised into the debate now so that we can give solution to that. It's part of our claim, and it's part of what, as a Council of Youth, we want to claim. And it's an important part of what I wanted to share here today. But talking about mental health and young mental health is also talking about addictions. According to the study of age ranges from 2022, which was the last one that was published, young people are the ones that are more likely to have an addiction. It is true that from 35 years old onwards, everything regarding medication for anxiety has an increase in their consumption, but the rest of substances have mostly young consumption, and they have an earlier consumption. They start using alcohol and tobacco from 16 years old onwards, not legal drugs from 18 years old onwards, and we are the age group that unfortunately has it easier to fall into any kind of addiction. And in the end, and just to try to close up and to try to be brief, young people are part of the debate. We are part of this conference. Why? Because we have made an effort to do so. We have done claims so that we could use youth lenses to each one of these policies, but mainly to those that are affecting us the most, because 30% of the calls to 024 have been done by young people, 30%. When it's 5 million people out of 47 people, 30% of those calls have been done by young people. You will allow me to end up with a verse. Miguel Hernández said that the salvation of Spain depends on its youth. I believe the assignment is a bit too big for us, but what we can offer is, hey, what's up? Active listening and actually raising awareness that we have a lot to do in mental health matters, but the youth of this country is an ally, and it's a very important ally. And to end up before in the suicide roundtable explained an anecdote that gave me chills, because I could have explained it. I was about 14 years old, I was watching TV, and suddenly I heard a loud noise that I will never forget. It was the father of our neighbor who had just jumped out the window. He could have fallen in the garden of my house. He fell in the common area. And why do I explain this? Because it is true. It's a lot of people in this room today, but actually it's not as many, so that we have two such similar stories on suicide. And I just wanted to leave you with this anecdote also, so that we could give a name to this, so that we can give visibility to the fact that despite it being a taboo topic, it's a reality that should concern us and be concerning to us. Thank you very much.
Moltes gràcies, Pau. Beníssim.
Thank you very much, Pau. The truth is that I have to say that, just like Iruni was saying at the beginning of the intervention, I had a high, because people in our generation, and you looked at me, and then I realized you were not looking at me. But well, I had an initial rush. But well, we only have time for very short 3 questions and 3 answers. First of all, I'm gonna ask the first 2 interventions. This morning we heard this disassociation between the institutions and what we actually do in the clinical practice, and how we are lacking in this country a more communitary and closer attention to the places where people are in our work environments and schools. And I know that there are several regions in which they are starting, or they already have some programs in which the professionals for mental health, clinical psychologists, mental health nurses, etc., they're working in schools, and that's their workplace with teachers, with students when they require so. And there are countries such as Finland, for example, and other countries in the north of Europe in which in their curriculum, in the primary school, they have topics that are regarding mental health. So I would like Luisa or some of you to explain what you think about mental health in schools. Well, I wanted to continue with what I said before about this law. And in this law, we established that in the centers for students in Spain, this is what we did. This is what I presented, what we explained before with several texts. But the most important part here is that in this law, we established that in these centers, there had to be a professional so that they could help students, so that students could talk to them. The coordinator of well-being. The coordinator of well-being had to be there so that if someone had problems, they could talk to them, so that they could talk about their problems, so that they could help each other, so that it could improve the situation in high schools, schools, and wherever they are. But maybe, at least personally, I don't know if you have seen that in others, I have not felt any difference so far. Could be because, well, this year it was still not established this law very deeply, but I have also not seen any difference. Allegedly, this coordinator is already present in schools, but I have not seen any news regarding this. I don't know if you have anything to add. Well, also, following up on the topic, we have said in some of our meetings that we saw that it was very convenient to do workshops or talks on mental health from the primary education and with the necessary information to each age range, because maybe a child that is 7 years old, you can't tell them when they're the same thing that when they are 16 years old, but we can start talking about the topic so that they can actually detect whenever they have a problem, whenever they're not feeling well, so that they know how to ask for help. Because in the end, many people have mental health problems, they have disorders, and they don't ask for help, and they don't even know they can ask for help. So we thought it was important to give information so that it stops being a taboo, but for real this time, from very early ages, to start giving information to prevent. It's another problem I can see. It's mainly that when asking for help, there are some children and teenagers that do not know that they need help. And even if they do know that, they don't know how to ask for help. Because, for example, the initiative from the coordinator, if I'm not mistaken, in the high school where Carmen and I attend to, we already have this initiative, we already had this person, but there's no one to tell you that this person is there for you. Because before this topic and talking about this and this law, I did not know this existed. And the problem is that we don't explain how to ask for help. That's true. 50% of children and teenagers with suicidal thoughts has never told anyone, nor their parents or their teachers or their friends or their classmates. And 50% of the children and teenagers that have suffered bullying have never told anyone. Something I wanted to add was that we wanted to we need to pay special attention to bullying or harassment situations, because they could lead to serious disorders or problems with mental health or even suicide, because in Spain we have had several cases because of bullying, and we need to be careful, and we have to pay special attention to those isolation cases or exclusion cases, because very often children or teenagers don't ask for help, teachers don't realize, or they see that, but they don't do anything, and that could create problems in the person. Great. Luisa, I believe there are two aspects in the collaboration from the education healthcare sector. One aspect that could be more for promotion of health and mostly prevention, so that we could have some programs that I believe are well done, mainly, for example, in the Basque country. For example, teaching what I said before, having resilience and self-esteem and social skills, etc. And I believe there have been several pilot programs that are being extended in several regions. And then we also have this assistential collaboration, let's say, which is when the school detects or teachers detect that there could be a child with a specific pathology or just symptoms that could make them think about this. We have to have a derivation mechanisms that has, or referring method that has to be very early on. We have programs in several regions. In Catalonia, there's a program that's called Salud de Escola, Health and School, and the nurses, for mental health nurses, they go to these centers and they could refer specific patients with specific priority so that they can receive that care. So these two possibilities are good. Also, Ona, you have talked about a risk group that I believe recently in some regions has received stigmatization, which is unaccompanied minors, and you have talked about the importance of training for the professionals who are giving the service. I believe that my impression, I don't know if you share it, is that there is an important lack of training in mental health professionals, because remember, these are minors that don't only have chronic stress, but they have also suffered very important traumas in their lives, surviving to the conditions in which that they have undergone. And a fundamental aspect, which is that training that is transcultural, so that mental disorders do not manifest in the same way in people from the sub-Saharan area or some other parts of the world. So something that you could add with regards to this? Yeah, I totally agree with your opinion. We work all around Spain with this collective with unaccompanied minors. We prefer to call them moving infants, because this term does not stigmatize this collective as much. And we agree that in the whole country, we work with centers, host centers. And once they get here, it's usually the institutions for children and teenagers who mainly take care of them. Mostly it's boys. And the workers in these host centers, they don't have enough knowledge on mental health, but also about international protection, asylum, and other topics that have an incidence in mental health. So what we try to do is, through different projects, we want to do this training, and we want to update it every year. And especially we do a lot of training in asylum topics, also transculturality, on this transcultural approach that should also always be applied when dealing with migrant and refugee children, especially if they are not accompanied, and also putting more incidence not only in the workers in these centers, but also on a political level with the different administrations. We work with different projects to have procedures that are much more friendly with children through the assessing of their alter well-being, etc. That's great. And Pau, I wanted to ask you, because you've talked about generation and how things have changed. Maybe the basis is the same thing, but the way of expressing yourself can change, just like different cultures. And something that is concerning and concerns us for young people's mental health professionals in this country and the rest of Europe and the rest of the world is the increase that there have been in self-harm in teenagers. Different kinds of self-harm possibilities like cuts, and as a way of a call out for attention. What can you tell me about this? The truth is that you have actually shocked me with a question, and the truth is that we have different policies that say that they have been increasing due to a general demand on what you were saying. It's a need for attention. It's a need for expressing, I'm here today and I'm not feeling well. And if I don't harm myself physically, if I don't do something that's visible, you're not going to believe me. You're not going to see it. You're not going to believe it. So the reality of self harming behaviors, in most of the cases, what that is hiding is a need of just stepping out and speaking up in one of the most terrible ways, which is self-harming, so that someone can lend you a hand and help you. The increase of these self-harming behaviors goes together with these anxious behaviors and losing lives, years of your lives, locking yourself in your house or in your room, along with your thoughts, such as the pandemic years. And that's closely linked to that, because when there was a moment in which you had to ask for help and you have not received an answer, or you have received stigma, how can you not be okay if you uploaded pictures on Instagram smiling? So in the end, we just end up with physical harm because, as the colleague said before, if you break an arm, no one is going to question you. If you say you have just had a panic attack, if they have not seen that, they can question that. Thank you. I'm sorry I'm being especially generous, but you have completed 1 hour and 5 minutes, and I have to guarantee that you all get your lunch. That's great. We're going to end up in 30 seconds. It's so good to be a moderator. For example, if I break my knee, I'll just get a cast and people will feel empathy towards me, towards my suffering. But so many teenagers prefer to have physical harm than emotional harm because it harms them less, and they kill that emotional pain with physical pain, like cutting themselves in those self-harm techniques. The thing that I loved about emotions and the definition that they have done of the addition of envy and happiness, and that's what you feel when you're envious of how someone is, but at the same time it makes you happy to see others be like that. And I was very happy to see you all in this situation and talking about this. Thank you very much.
Muchísimas gracias, de verdad.
Thank you very much. We're going to have a break now, a lunch break. We're going to have about 1 hour. We had to be here about 3:40. And remember, it's the 14th of November. We're in the Niemeyer Center. We're in this high-level meeting on mental health in the framework of the Spanish Presidency of the Council of the European Union. We make this short break and we'll come back. Thank you.